I'm Julia Keogh, and I'm the president and CEO of Health Imperatives. Health Imperatives' mission is to improve the health and well-being of low-income or vulnerable families and individuals in southeastern Massachusetts. Health Imperatives has a number of different programs. So many young people, all genders, but particularly women, are bought and sold from young ages and preyed upon. And we found that most of the people have histories of child sexual abuse. Almost all are first trafficked as teenagers, and they get trapped in this cycle where if they didn't already have a substance use disorder or mental health concerns, it leads them to that. A few years before we started developing Sanctuary Place, Health Imperatives and the Plymouth County District Attorney's Office were awarded a $1.5 million grant from the United States Department of Justice to develop a human trafficking task force. And over 3 years, we worked together to help people identify victims of trafficking. We worked with these other providers to come up with ways of providing services to people in this situation.
Tell me why a program like Sanctuary Place is so important.
It's so important because there are so many people who are in these situations and have nowhere to turn. So many women who have been exploited as young people are experiencing homelessness, addiction, and there's no program or house for them. And what we found was the ability to provide housing with really meaningful services and supports, and to have it led by other people who have been through it and know what it's like is just amazing.
I think a lot of people don't even realize that it's happening here in our own backyard in Massachusetts.
8 years ago, we developed a similar type of program where we converted a row house into a building that could be housing and services for survivors of trafficking. And ever since that point in time, we've been looking for another opportunity to do something similar. And we've been fortunate to find this place and fortunate to be introduced to Health Imperatives. And we've been very grateful for the partnership with Health Imperatives to combine both our experience on the conversion of this type of a house with their ability to provide much needed services to survivors.
My role really is going to be just helping the residents that live here and directing the staff to ensure that, everybody's getting their needs met. The women have lived very traumatic events and they need somewhere safe.
I started as a child care worker in a group home for adolescent girls where I worked with a lot of kids that were sexually abused. And so that's kind of throughout my career, working with survivors and really recognizing resilience and strength and finding hope in situations that might seem hopeless. We're very concerned with affordable housing and making sure people have a safe place to live. We're really honored that we had the opportunity to name the living room for our moms.
And that's moms, plural.
Moms. So Bill's mom is Dorothy and my mom's Lorraine. They were both strong, powerful, funny, compassionate women. And so they would love the work that's going to be done here.
Sex trafficking isn't just one-dimensional, it's multidimensional. There are so many components that make up this vicious circle of a woman's life.
It really demonstrates the tenacity of the Health Imperatives team. Do the hard work. That's one of the things we're not afraid to do. We've developed an incredible team. Since I became chair, we've really taken a very close strategic look at all the services that we have offered and where the holes are in our program that we could really boost to help the underserved populations in Massachusetts. There's no gift or effort too small. I would encourage people to go to healthimperatives.org, our website, look around, see what we do. Sanctuary Place has been a huge effort over the last year or so, but we have another shelter for victims of domestic violence. We have 7 clinics throughout the south coast of Massachusetts and on Cape Cod, Martha's Vineyard, and Nantucket to serve underserved individuals.
I am so grateful for you, Julia, and for this work. It's really incredible if we think about the journey that these folks have taken and where they now get to be in this incredibly safe place that is so aptly named as a sanctuary for them.
I really wish there was a place like this when I was around, you know, and they didn't have places like this. There actually isn't a place like this.
Thank you all so much for everything that you've done to help us open this beautiful home.